So, if you look in the NCCN guidelines, there are two multi-kinase inhibitors that are suggested. Those are vandetanib and cabozantinib. And we know that those drugs in general have relatively low activity, so response rates perhaps in the 15 to 20% range, progression-free survival only in the few months. And again, this is because they're not able to be dosed appropriately because of side effects. When we look at the selective RET inhibitors that are emerging from clinical trials, selpercatinib and pralsetinib, we're really seeing far more meaningful activity, response rates much closer to what we expect from a good targeted therapy like we see with EGFR and ALK inhibitors. So objective response rates in excess of 60%, progression-free survival rates that are a year or more. And some of this data is still emerging, so we don't have fixed numbers yet, but it's very clear, even from the early data analysis from both of these new and exciting selective RET inhibitors, that we're seeing far better efficacy in terms of objective response rate, progression-free survival, and also importantly, intracranial activity. That's not something that we've talked about yet. Patients with lung cancer often have very high brain metastasis at diagnosis or will develop them later. And so having meaningful intracranial activity, meaning that the drug penetrates into the brain and can cause tumor shrinkage and tumor control, is really critical. And I think we're seeing that from these new selective agents, and that is really exciting for our patients. And so again, when we think about the older multi-kinase agents versus these new selective RET inhibitors, we're seeing far better efficacy, and again, with far fewer toxicity. And so that's really what we want for our patients.